Hello and welcome back to GP Video Podcast by Nadia. So, what I'm going to do in this video podcast and the upcoming video podcasts is to share some journals from Australian Journal of General Practice, which is AJGP, so that I would be talking to you about facts and figures and would be sharing the entire articles with you in short video podcasts. Okay, so this one. The current issue is now out, and the article that I'm going to talk to you about is pharmacotherapy for the management of overweight and obesity. Okay, what is the background? So it says that lifestyle intervention is the mainstay of obesity management. So lifestyle intervention is the mainstay of obesity management. However, behavioral modification alone produces only modest results, and attempts to create a negative energy balance are offset by a biological response to maintain weight. So this is very interesting to know, that I didn't know about this, that body can actually fight losing weight. So see, this line again is very important, that attempts to create a negative energy balance are offset by a biological response to maintain weight. So behavioral modification alone only produces modest results. Pharmacotherapy is indicated as an adjunct for those living with obesity, which is body mass index more than 30, or those who are overweight, body mass index more than 27, with one weight related complication. So objective is that this article provides an update on pharmacotherapy for the management of overweight and obesity. And it's very interesting to know, when I went through the list of the drugs available for the pharmacotherapy for the management of overweight and obesity, there actually has been an addition of a couple of agents, one injectable and one oral agent, which actually is used as migraine prevention therapy. It is an anti-epileptic, and also is used as a migraine prevention therapy, and it can actually be used in which is called topiramate, and it can also be it can actually be used in conjunction with phentermine or duramine. So we'll come to that. It's a big list, and there is another injection which is called Orlistat. I'm not sure if this one is already available in Australia or not, but we'll have to find that out. But there is a big list that we can go through. We do know about the agents that are available, like Wegovy, like what is it called, Mounjaro, like Duramine, like the combination drug ibupropion and naltrexone, which is called Contrave. But now phentermine can also come in combination with topiramate, can be used in combination with topiramate. And then there is another injection called Orlistat. But we'll talk all about it when we come to that section. So objective, this article provides an update on pharmacotherapy for the management of overweight and obesity. Discussion: pharmacotherapy is a useful adjunct for the treatment of obesity and obesity related complications. When considering pharmacotherapy, thought must be given to efficacy, contraindications, potential side effects, cost, and duration of treatment. Then it says that obesity is a chronic disease affecting nearly 1/3 of Australian adults. It is the result of a complex interplay of genetic, environmental, and socio-economic factors, and is associated with a number of serious comorbidities, including cardiovascular disease, cancer, type 2 diabetes, and metabolic associated fatty liver disease. Obesity contributes to reduced quality of life and premature mortality. Very, very important to know. Reduced quality of life and premature death or premature mortality. Lifestyle intervention is the mainstay of obesity management. However, behavioral modification alone produces only modest results, and attempts to create a negative energy balance are offset by a biological response to maintain weight. Pharmacotherapy is indicated as an adjunct to lifestyle modification for those living with obesity. Who are called obese? Anybody who has a BMI more than 30. Anybody who has a BMI between 25 to 30 is called overweight, while anybody who has got a body mass index of more than 30 is obese. So as I said, that pharmacotherapy is indicated as an adjunct for those living with obesity, BMI more than 30, or those who are overweight, BMI more than 27, with at least one weight-related complication, including type 2 diabetes, dyslipidemia, hypertension, metabolic-associated fatty liver disease, obstructive sleep apnea, and osteoarthritis. It can be used as an adjunct to lifestyle modification, including energy restriction and increased physical activity. So this is what lifestyle modification means. So exercise and diet. Weight loss of 5 to 15% has been shown to improve or prevent progression of obesity-related comorbidities. So 5 to 15% weight loss can actually improve or prevent the complications, with greater weight loss resulting in more substantial improvements in complications and quality of life. The risks and benefits of pharmacotherapy for the management of overweight and obesity, including the additional benefits on cardiometabolic disease and its risk factors, should be considered prior to initiation of therapy. We'll come back to this article in my next video podcast.